Hey guys, let's have a conversation. I realize I'm wearing a lot of pink today, but anyway. So when I was preparing for my first interview, I did a lot of research. I watched so many videos about what to say, how to dress, what to do with your hands, what to do with your face. And this is not going to be a video of me explaining all of those things. There's a lot of material for that out there and you can go check it out. I definitely think that it's very important to do that research before you go on your first interview. But what I'm going to do today is just share my experience of my first nursing interview, what questions I was asked, and what answers I gave. I'm not gonna say all of my answers for the sake of time, but I am gonna explain a little bit what I said, and I am going to mention every single question that I got. Going down for your first interview can be very nerve-wracking, or any interview for that matter. But if you make sure that you're prepared and that you know what you're going to say, and even if you kind of know what they're going to ask you, that will really help decrease that anxiety that you're feeling. It's gonna help you be more confident, and it's going to help you just reflect who you really are better, which is the ultimate goal here. Some principles that I do want to mention is 1, try to turn anything that you say into something good. So if they ask you for a weakness, choose a weakness that you can turn into a strength. If they ask you for a difficult situation that you went through, turn that situation into how you made that situation better. So the first question that I was asked was, why did you choose nursing? I basically said that I hadn't really picked nursing, but nursing picked me, that I had always wanted to do that, and that I just felt a calling to take care of people when they were at their most vulnerable. Then they asked me to define excellent customer service. I defined excellent customer service as basically putting the customer's needs first, being resourceful, understanding what resources you have in order to solve problems that the customer might have. And then as a follow-up question, they asked me to describe a time when I provided excellent customer service. And because this was a nursing interview, I used a story with a patient that I had where I went out of my way to spend time with the patient and listen to them braid their hair, clean their nails, and just talk with them to decrease their anxiety exacerbations. So as you can see, not all the questions are going to be straightforward. They're not going to be like, explain to me a time when you cleaned a patient's poop and didn't cry about it. We're going to ask questions that are very ambiguous, like, explain a time that you dealt with conflict, with a difficult patient, that you showed compassion maybe. It's just gonna be very abstract. And you have to have a repertoire of experiences, patient experiences preferably, maybe that you had in clinicals if this is your first nursing interview, and tailor that story that you have in your repertoire, your little arsenal of patient experiences, tailor that story to the question that you're being asked. The next question that they asked me was, how would you deal with family members of a patient that are constantly complaining? Again, I went back to a story with one patient whose husband kept telling me that his wife was in pain and nothing was being done to manage it. Very important tip here, guys. Never, ever, under any circumstance, ever speak ill of another nurse, of another doctor, of any other healthcare provider, of anyone in your work. They might have been awful, they might have been mean, you might have been a victim, and it might be true, but you do not say that in the interview. For example, in my work situation that I gave, the patient kept asking for pain medications because they were in so much pain, and I went to the nurse, and the nurse basically just dismissed me. She just straight up ignored me. But I'm not gonna say that in the interview. I'm gonna say something more sugar-coated, like, you know, the nurse had other priorities at the time, maybe the nurse wasn't too receptive to my suggestions. Just find a way to say it so that you're not being condescending or judgmental, because that's definitely gonna be a big red flag for your interviewer. Then they asked me at the beginning of a shift, how do you organize, basically prioritize all of the tasks that you need to accomplish during the day? How do you go about that? So my answer was, at the beginning of a shift, I categorize the different tasks that I need to accomplish. I see which ones are going to take more time, which ones are gonna be easier, which ones I'm gonna need assistance for, and which ones I can complete on my own. Maybe grouping those activities, like if one patient needs a lot of things done, maybe trying to group those so that you're not constantly going in and out of the patient's room, and then seeing which things are most urgent and which things can wait, and based on that I just prioritize. They also asked me, what is your strongest asset? Okay, this is the time when you want to shine, when you want to tell them what they want to hear. Of course, don't lie. Actually try to tell them something that you are good at, because if they do hire you and you're not good at this, they're pretty quickly going to notice. So this is when you want to mention team working skills, communication skills, connection to patients, rapport, all that stuff. Then they asked me, what is my greatest area of improvement? This is a tricky one because a lot of people will be really personal in this answer and very vulnerable, which this question does ask for a bit of vulnerability, but you don't want to be too personal. And you definitely don't want to say something that is straight up a character flaw. And going back to what I was saying earlier, you want to take this weakness and make it into something good. Don't use any strong words like blunt, inflexible, impunctual, anger. Like for example, if your greatest weakness is that you get angry very easily, don't say that. Just say, I can sometimes get frustrated. This was actually the hardest thing for me because I'm somebody that's super direct, and trying to sugarcoat all of my words to be nice was rough. That was the hardest part of interviewing for me. But what I answered for this question was that because I'm a very genuine person and I like things said to me very directly, I sometimes can throw people off with my very direct answers or requests to them, and so I need to learn how to tailor my message to the person that is receiving it to best convey what I actually want to say. See what I did there? I used a flaw that was very like borderline an actual virtue, being direct, and turned it into something that, you know, I'm working on it and it's good. And when I said this, the interviewer actually said, whoa, what a great answer. Apparently she also had problems being too direct. And then I got a question that was really weird. The interviewer said, what would you do if your assistant, basically if a tech, a CNA, comes to you and says, your patient's not responding? And I asked, what do you mean not responding? And she was like, yeah, I always get that follow-up question. Just tell me what you would do. The CNA comes up to you, she says your patient's not responding. So I said, well, first I would analyze their body language. Like, did they come to me running or were they just casually walking? Is their face showing me a sign of urgency, or are they just kind of, you know, casually telling me that they're not responding? Then I would probably take 2 seconds to say, define responding, and then I would rush to my patient's room to assess what's wrong. Those were pretty much the questions that I got asked. And this was a phone interview actually. But even though it was a phone interview, I was so nervous. I feel like phone interviews are the best, and like Skype interviews, because if it's Skype, you can have all of your notes kind of around the screen and they can't really see them. And if it's phone, you can make all the facial expressions that you want and they're never gonna know. So I really appreciated that. But I was still really nervous. And so what I did is something that I wanna teach you guys. It's something that's called military breathing. I learned this from my retired police officer who came to our school to do an active shooter scenario. Very interesting. And he told us that there's this thing called military breathing, where you breathe in for 4 seconds, hold it in for 4 seconds, and then release for 4 seconds, and repeat that like once, twice, or 3 times. That will immediately bring your heart rate down to functioning range. Because when your heart rate's going too fast, you're losing your cognitive abilities, you're like trembling and you can't really think straight. So if you go in on an interview with your heart rate really up and you're very anxious, you're probably going to stumble on your own words and you're going to regret everything you said going out of that interview. So my recommendation to you is, before you go in that room, just pause for a moment and just breathe in for 4 seconds, hold it for 4 seconds, release for 4 seconds. I assure you, this is going to work. Another very important part of getting a job is having a good resume. And if you want to see my video talking about how I did my resume, you can click right here. If you want to see other videos about nursing, these are right here. Thank you so much for watching. Good luck on your interview.